In Vitro Fertilization by Abigail, Gloria, Emily, and Gong Hee. In vitro fertilization is one of the most commonly known types of assisted reproductive technologies. It includes a complex series of procedures used to help with fertility or prevent genetic problems and assist with the conception of a child. IVF may be an option for those with fallopian tube damage or blockage, endometriosis, ovarian aging, previous tubal removal or sterilization, uterine fibroids, impaired sperm count or production, those who will start chemotherapy or radiation and wish to preserve eggs. So there's 6 phases of IVF. Phase 1 is ovarian stimulation and hormone therapy. It is given along with medication to prepare lining of the uterus. Phase 2, eggs are removed from the follicles through a needle connecting to a suction. Phase 3, sperm is separated from the semen fluid in the lab. Phase 4, healthy sperm is injected directly into each mature egg. Phase 5, embryo development. Lastly, phase 6, embryo or embryos are transferred with a syringe into the uterus.
Here are the risk factors associated with IVF. IVF increases the risk of multiple birth if more than one embryo is transferred to uterus. Use injectable fertility drugs such as human chorionic gonadotropin induces ovulation, which can cause ovarian hyperstimulation syndrome. Some symptoms typically last a week and include mild abdominal pain, bloating, nausea, vomiting, and diarrhea. Ovaries become swollen and painful, also cause weight gain and shortness of breath. The rate of miscarriage for women with fresh embryos is similar to that of women who conceive naturally, about 15 to 25%. About 2 to 5% of women who use IVF will have an ectopic pregnancy when the fertilized egg implants outside the uterus. The fertilized egg can't survive in a fallopian tube. Birth defect rates increases with maternal age. Use of an aspirating needle to collect eggs could cause the risk of bleeding, infection, or damage to the bowel, bladder, or a blood vessel. Use of IVF can be financially, physically, and emotionally draining. It is time-consuming, expensive, and invasive.
So some of the ethical issues associated with IVF include age limits. This is an ethical question of whether there should be an age restriction for IVF candidates. The age range discussed is between women in their 40s to 50s. Those in support of an age limit argue that a child has the right to a safe childhood and adolescence, and this might not be possible if the mother has an age-related risk of disease and possibly dying. Another argument is that an advanced maternal age puts the woman and fetus both at risk of survivability, and advancing maternal age decreases the success rate of IVF. And then arguments against the age limit is that reproductive autonomy is really important and a woman should have the right to choose when they want to have a child. Another argument is that middle-aged women are often more psychologically mature. They have more of stable income and economic background. So it puts a precondition that's a very safe and stable for this future child. And then having an upper age limit can mean there's a formalized age discrimination. The next ethical issue is the ownership of gametes and embryos. So in some circumstances, it's kind of a question of should gametes and embryos be utilized in a participant that doesn't survive, meaning that if someone who is donating their eggs or their sperm after going through before going through cancer and radiation, if they pass, is it still ethical to utilize their donation? And this kind of just goes hand in hand with informed consent. In some countries, it's actually prohibited even with informed consent, including France, Germany, Sweden. And then the US is kind of just in between, depending on what clinic. IVF pre-implantation genetic testing is an ethical concern, just because with IVF, you can use genetic testing to see if the embryo is at risk for severe monogenic disease or a high risk of aneuploidy. But when you start modifying these genetics, it comes to an ethical question of, will we go past that line and start doing more genetic testing on physical attributes and things like that? And then the last one is just the public funding for IVF. Should it be publicly funded?
Okay, so I'm going to be discussing the faith integration. So when a family makes the decision to go through with IVF therapy, it is usually due to the fact that they have been struggling to get pregnant on their own. This can be an extremely difficult time for a family and can cause extreme emotional and spiritual distress. According to Dombo and Flood, infertility can impact self and relational identities of people wishing to become parents. Therefore, there's a risk of both a crisis of identity and of faith. So as the nurses, it is our responsibility to assess the patients and their families' emotional, mental, and spiritual state regarding the infertility. We should conduct an assessment of their faith and religious beliefs, which I'll go over in a few minutes. And finally, we must build rapport and establish a trusting relationship with the patient and their family to allow for them to talk about their religious preferences, if there is a spiritual crisis occurring because of this hardship, and to determine how we as the healthcare team may help in their situation. So one spirituality assessment tool that we can use, it's extremely easy to use and very beneficial. It's known as the FICA tool. So the F is for faith, belief, and meaning. We can determine whether or not the patient identifies with a particular belief system or spirituality at all. The I is for importance and influence, and this helps us understand the importance of spirituality in the patient and family's lives, and what influence spirituality has on healthcare decisions. The C in this acronym is used to find out if the patient is part of a religious or spiritual community, or if they rely on community support. Especially in this case, it may be important for the family to have a strong support system as they process the feelings of infertility and then going through the therapy treatment as well. And finally, A is for address or action. So we can learn how to address the spiritual issues with regards to caring for the patient by asking them how we can be of assistance in this difficult time. IVF can be an amazing experience for people going through infertility. It may bring hope back to the family, it may bring their faith back, but it's also important that we address these issues throughout the whole process. And that's it.